bent a little bit. You're coming up not on the patella, up into the thigh with your hand. Use your body to kind of stabilize their pelvis. I usually do it right about butt level is where you need to be. You're going to come on that ASIS, hook onto it so you can stabilize the origin, and pull that leg back. And get your stretch force that way. Okay? Or you can flip them on their belly. Slide over towards me just a little. You're going to bend the knee so that you can manage that leg a little easier, but don't bend it too much. If you bend it too much and then you go up into hip extension, hyperextension, you're going to be stretching rectus. So you'll miss out on the iliopsoas stretch and you're going to get more rectus. So if the rectus is tight, you'll start stretching that before you ever get to the iliopsoas. So some knee flexion, not too much. Your hands going on the pelvis. You don't want to be way up high on the pelvis because that will, as you push there, you're going to encourage trunk extension, hyperextension at the lumbar spine. I don't want to do that, so I'm a little bit lower on the pelvis, kind of hitting that bottom edge of the sacrum. This way.
Seems like it'd be harder on you to do that.
It's definitely harder on you. I never stretch anybody really, really tight like that because you'd be breaking out in a sweat. All right, the next one you can do. This is one I like to use to teach people for home. Go ahead and lie down on your back again. I'll have people do this at home, lay on the edge of their bed, and just drop that hip down. Now, if you're going to manually stretch from this position, you need to, and you can already see Pam put her hand behind her back, going, ooh, that doesn't feel good. You want to get on that ASIS, and you're going to anchor it, and then drop that leg down. I usually put my leg blocking theirs, so it doesn't just drop down and push them right into hyperextension. I want the whole thing to happen a little more controlled and slower. Okay. Or, most aggressive yet, you're going to come out to the end of the table. Bring your back side right to the edge of the table. Pull this knee up to your chest, and I want you to hold around your thigh instead of. Pet peeve of mine, when you have somebody pull a knee to chest, thigh. They should pull in the thigh, not on the tibia. They pull in the tibia, they create a lot of compressive force at the knee. Are you purposely doing that, or are you really that tight?
I'm tight.
See how she's already in this position? You see how she's here? Especially before gravity starts pushing her down a little bit. So again, you're on that ASIS. And then a little bit of overpressure distal thigh.
And you said this is the most aggressive?
This is the most aggressive. Okay. And more belly. And your belly. Rectus femoris, you're going to bring that hip into some hyperextension. Ice pillow, or if you have a wedge in the clinic, wedge works really nicely too. You don't want to bring them up so much that if you bring them up too much into hyperextension more than they really have, what you'll get is that rotation of the pelvis. So they'll just kind of roll out of it. So you don't want them up too far. Again, your hand placement is important. Don't come up on the very top of that iliac crest. Okay? If you do that, you're going to be on that lumbar spine too much, and you're going to create an extension force on the lumbar spine. If somebody has back problems, you're going to cause them pain. So you want to be more onto the sacrum. So hold on to that sacrum, stabilize that pelvis down, and then bend the knee. And just put that overpressure on until it's enough stretch for the patient. And how do you know when it's enough? I ask them. How's that? Comfortable? You doing all right? Need a little more? Because you'll feel when you get to end feel, and you start pushing into that end range. But how far you can go into end range really depends on the patient, how irritated the muscle is. If it's irritated, so how much overpressure they really want is variable between people. All right, quads as a group. Take your pillow out. Same stabilization on the pelvis. Same pressure here. And she'll feel that more in the body of the quad versus up towards the origin of the rectus. When you stretch rectus, they'll feel it in their quads, but they'll be able to feel a lot of it across the front of the hip. And when you stretch quads as a group, it'll be much more down into the belly of the quad. IT band. Flip on your side towards me, or away from me. Okay, IT band stretching. You need to make sure their trunk is pretty straight. If they have a fairly mobile trunk, you're going to bring them back into hip extension. Again, I use my body to kind of stabilize their pelvis, so I just kind of push right into them. And then think tensor fasciolata, kind of up here, comes down this way, kind of coming up into that tensor fasciolata muscle belly, hooking onto it, dropping down, and back. So back and down. Feeling that, Pam? You feel it in your back?
I'm feeling it on my other hip.
Too much pressure on your other hip?
Trying to see where her hand is. Actually, not in front of anybody.
Bring this hip back towards me instead of forward. This one's gonna roll forward. There you go, you gotta stay right there. I can roll her a little more forward. She doesn't have to be directly over it if that causes hip pain.
Yeah, that hurts.
Better there?
Mm-hmm.
Feel that more in your IT band now?
Mm-hmm.
Okay. Piriformis, coming back. There are different degrees of piriformis stretching. For somebody who's really tight, we're going to start here. And sometimes that's exactly where they are. They don't have much more than that. Sometimes I can't even get them across. Somebody who's really inflamed, I might even have to be kind of here with them because their leg will be out here. It'll be so tight. But cross at the ankle, across the opposite knee. Use some stabilization here to keep their pelvis down. You don't have to push hard, but some stabilization here, because if you just push and they're really tight, that whole pelvis will come over. And they'll get some stretch, but it's not going to be as localized and as effective. Plus, it's harder on the low back. So hold here, and then I'm just going to push across. You can get a little more aggressive by coming up. So you bring the knee up towards the opposite shoulder. Again, I like that little bit of pressure on the pelvis to keep it down. And then most aggressive of all, bend that opposite knee. Cross like into a tailor sit position. And you're going to pull this bottom leg up towards your chest, so grab around your thigh. And pull it in as far as you want. And then my job is just a little bit of overpressure, pulling this knee towards, pulling the hip towards external rotation. You don't need a lot. This is an aggressive stretch. I mean, I don't need to crank on her in this position. So she pulls, she creates kind of the stretch for us, and then I just give that little bit of overpressure, and that increases the stretch. Glut max. Opposite leg down. This knee is coming up towards your chest. You're going to stabilize here, distal thigh on the opposite side, right up above the patella, to keep the pelvis kind of locked down. And just take the knee up towards the chest.
was trying to do these with my son over the weekend, and he's big. And I was sweating.
Mm-hmm. Yes. Yes. And somebody who's tight, this is, it is a physical workout for you. You stretch somebody with high tone, and it is like a contact sport. It's you have to get really good, really quick at using good body mechanics, using your body weight effectively, because you will not outmuscle somebody with high tone. You can't just use your arm and think that you're gonna outmuscle them, because their tone, I mean, they can practically kick you across the room if they end up with a tone reaction, and that tone kicks in, and you know they'll push you halfway across the table. You have to. I usually put them on a big mat table, and I'm up on that table with them, so that my center of gravity is much lower, much closer to my base of support, which makes me more stable. But then I can use more of my body weight to lean into that person and create the stretch force. But you need kind of that double whammy of, you know, you need your stability, plus you need to be able to create a little more force. Gastroc and Soleus. Gonna get on the calcaneus. So if you can do it, best grip is to come this way, kind of straight onto that calcaneus. I can't do that. I don't have enough strength in my fingers to be able to do this grip well. So I come across it this way so I can get the narrower part of the calcaneus, and then I can get a better grip. So you're gonna create that stretch on the Achilles tendon first. So kind of take the slack out of the Achilles tendon by pulling down on the calcaneus. And by down, I don't mean down towards the floor, I mean down the length of the body. So if this is top, this is up, and that's down. So pull down on it. You're gonna put a hand up above the knee, and you're gonna lift up just a little bit on that lower leg to take the slack out of the knee. And then their foot is coming up your forearm, and you're gonna push through the ball of the foot and bring them into some dorsiflexion. And that'll get you a good gastroc stretch, kind of the whole length of the gastroc. Soleus. Bend the knee a little bit. Okay, I'm set down towards the end. I like to have them slightly over the end. If you keep their whole leg on the table, by the time you get under them to get the calcaneus, a lot of times you're not meaning to, but you're inadvertently pulling them back up into knee extension, which is not really where you want them to be. So I like them off the edge of the table to do Soleus. You're gonna hold kind of distal tibia right up above the malleoli. So you're stabilizing them into some knee flexion. Same thing, get a hold of the calcaneus, pull down on it to take the slack out of the Achilles tendon. And then push them up into dorsiflexion with your forearm. And you do want to be careful you're not pulling on the toes, that's not where your force comes from. So you don't want to be, you know, sometimes I'll see people stretching and they're stretching kind of like that. That's going to be a great plantar fascia stretch. In fact, BM's on a big stretch right now. I can feel that in her plantar fascia. You want to be on the ball of the foot. So you're through the metatarsal heads. There. All right, and that's going to get more soleus, which you're going to feel more here. Okay. Practice away.